Thank you for your interest in our residency program at the University of Cincinnati, Department of Obstetrics and Gynecology. My name is Michael Thomas. I'm the chair of the department, was formerly the division director for 19 years of reproductive endocrinology and infertility. We appreciate you applying and coming to visit our program. It's important that we allow you to look at all aspects of the Department of Obstetrics and Gynecology. I think you'll have a very fun day in this virtual arena to sort of look at what we do and how we interact with each other as faculty, fellows, and residents.
My name is Dr. Rhea Eubanks. I am originally from Columbus, Ohio. I went to Washington University in St. Louis for undergrad. I went to Loyola University Chicago, Stritch School of Medicine for med school, and I am currently an intern.
I'm Roger Rothberger. I'm an OBGYN resident in my third year.
My name is Amanda Baucom. I'm a second year obstetrics and gynecology resident here at University of Cincinnati. I am from North Carolina. I went to school at East Carolina University for undergrad, my master's in medical school, and now I'm here.
My name is Jeffrey Thode. I'm one of the third year residents at UC.
My name is Jenny Wolf. I'm one of the fourth year residents. I'm also one of the admin chiefs. I'm from Cleveland originally and went to Penn State for undergrad, and then I came to Cincinnati for my medical school and decided to stay for a residency.
I chose to come to the University of Cincinnati because I was looking for the program that was the best fit for me. When I was on an interview trail, I was always assessing and analyzing how I felt about each program and if I could see myself there. And on my interview day here, I really found that I could see myself in this program.
After looking at this program, found that it really provides like a good diverse education in that you get really good generalist education, really in the high risk sort of portion of obstetrics and gynecology. You don't get bogged down in doing a enormous volume of kind of low risk sort of things. You kind of get the whole spectrum, but really get a good feel for the higher risk portion of both obstetrics and gynecology.
I was looking for a program that was in a big academic center, but also had some more community aspects into it. And then I was also looking for a program that had a really strong generalist division, because that's where I saw myself going in the future, and it's offered all of those.
So first, I couples matched. My husband is a general surgery resident here as well. When we were applying for residency, one of the big important things to us was training in an academic center. When we came here, it was very interesting to us that not only did we get exposure at an academic center, but we also got exposure at a community hospital and a premier community hospital such as Christ.
I had a unique look at the program, and so I ended up choosing to stay here for residency because of my experience as a medical student and really getting to see what the interactions were like between the faculty and the residents.
The residents and the attendings have a high standard for the interns, but they are always so supportive and motivating to get you to your personal goals and the goals that they have for you. I also believe that they chose our intern class really well, and we all get along so much. We are constantly talking to each other, giving each other tips for the next rotation, hanging out with each other on our free weekends or weekdays that we have, and it's a very supportive environment.
I would say that we have a great relationship here with the faculty. I have good working relationships with a lot of our faculty members, and then also have good relationships with them outside the hospital as well. And I think that goes for faculty that are in the generalist division as well as some of our subspecialties. I think they're people that I'm comfortable with in every subspecialty talking to about questions pertaining to patient care, but also about things in life and kind of mentorship along those lines.
One of the most important things to me when choosing a residency program was I wanted to feel like I was in a big family, because unfortunately in residency you spend a lot more time with your co-residents and with your colleagues and your attendings than you do with your own family. That's just the way residency works. And so when I interviewed here, there was a very good relationship that I could see between all of the co-residents and with the faculty, and that's very true of how it still is.
It's definitely one of the reasons that I chose this program. Each of the faculty has come from a different program, or even if they're from here, have a different way of doing things, but they never force you into their way. They're very open to teaching and wanting you to understand why they like to do things the way that they do, and helping you to become a better clinician and a better surgeon at the end of this. I have so many attendings here who aren't formal mentors for me, but who have really shaped the way that I practice and the way that I want to continue to practice when I leave here.
I think it's very important to have that relationship, that you could go to them with anything if you're struggling with anything, or if you need to learn something better. They're very approachable. You can talk to them about things that are even outside of medicine, and I think that's very, very important because, like I said, you spend more time with these people than you do with your own family.
Whenever we're on a rotation with them, they push us to be the best physician we can for our patients. They are always there if we have any questions, and there to help us. They motivate and encourage us every day, and it's been such a pleasure to work with them on the rotations.
Our patients here are very unique. When I first came here as a medical student, I thought this was just a typical Midwestern town that would have the kind of people that I had grown up around, but we actually have a huge population of immigrants who come here. We use the phone interpreting service very regularly and get to meet women from a lot of different cultures. So we have a big Hispanic population who's living here. We also have a big population of women who've immigrated from Africa. And so we get to learn a little bit more about their cultures and how that affects their care.
We have a lot of complex patients that we get to take care of and manage at University of Cincinnati Medical Center. We also see a lot of patients that we may see in community who aren't as complex, but we would potentially see in our future career as obstetricians and gynecologists.
We operate as one of the social safety network hospitals for the region, so we take care of a lot of the underserved population, but also as the large academic referral center, we also take care of some of the more complex patients in the region, patients that require multidisciplines to be involved in their care and that sort of thing.
We get exposure to the sickest individuals in the Midwest, which is very, very interesting to us, but also a lot of fun because you get to train with a lot of different experiences that a lot of people don't at other places.
One cool thing about this program are the community clinics that us residents are able to go to with the attendings we work with. We see a wide variety of patients from insured to uninsured. If you speak another language, you can also exercise that skill at a variety of our sites because we have a lot of patients from all over the world right here in Cincinnati. I think this is a great way to develop as a physician and to take care of these patients who come from different backgrounds, who have different barriers to medical access that you're able to actively work around to provide them the best care possible.
The University of Cincinnati is a very large medical school. We work with medical students on all of our rotations. So we have medical students when we're on labor and delivery, gynecology, gyn-onc, and at Christ. They also frequently rotate with us at Westchester as well, which is where we do a lot of our outpatient surgery, or rotate on our Urogyn service is mostly at Westchester. We get to teach medical students in many different areas. Not only do we get to have them when they're on our service, but we also can do lectures and stuff for them as well on topics that they find to be important for their shelf or important for their understanding of general obstetrics and gynecology. I find working with medical students to be very beneficial for my education as well, because it keeps you kind of up on your information and keeps you vigilant on making sure that you know everything about everything that's going on, because they're there as well to learn.
You get great subspecialty education in onc, urogyn, MFM is stellar here. You do as much or more, I think, fetal in your residency than most fellows get in their fellowship. So I think that if you want to walk out of here a great generalist, but also have a great shot at being any subspecialist you choose, I think it's a great program, which is why I picked it.
The subspecialty experience here is also one of the reasons that I chose this program. We get a really good early experience with the subspecialties, and coming in, I wasn't sure what I wanted to do, if I wanted to be a generalist or a subspecialist, and so I definitely wanted to have that experience early in my residency career so that if I decided I wanted to do one of them, I would have enough time to really get to know our faculty, get to do some research in that area, and be able to feel confident when applying.
I think one of the more challenging but also rewarding aspects of this program is the work we do with the Fetal Care Center. So we take care of patients in collaboration with Cincinnati Children's and take care of some of the sickest babies in their region. So it's really things that are very unique and often you won't see anywhere else. And so it's academically very interesting, it can be quite challenging, but I think it's also one of our most rewarding opportunities.
Christ is an interesting place because you're given a lot of autonomy there. You work with private physicians and it's usually just you and the attending physician. You get to do a lot of surgery there and you get to take care of a patient population that's different than at UC. At UC, patients here have a lot of medical comorbidities and are referred here because we are the referral center of a level 4 maternity center. However, at Christ, everyone is a lot healthier and we work with the community doctors and we see a lot of things that you would see in community practice and not just all the patients that are referred for their comorbidities.
So we do get to rotate in each of the subspecialties within the first 2 years of your residency, and I think my experience with each of them has been incredible. For oncology, you get to rotate as a first, second, and fourth year. For REI, you get to rotate as a second and third year. For MFM, we end up doing a lot of that throughout all of your L&D experience because we have a very high-risk population here. And so our MFMs are very actively present on L&D, but we also have separate rotations as a second and fourth year as well. So you get to experience things in the clinic, and then as a first year, we have a separate ultrasound experience with our MFMs where they teach you to be really good at not only doing the ultrasounds, but reading them as well.
So I think the thing I look forward to most as an intern is getting to the point I see our upper level and senior interns at. They are very confident in how they manage patients. They are very knowledgeable. They teach so well. They're so patient with us. And I want to be able to be like them for my future interns once I become a chief.
The Christ Hospital is another aspect of care that we get to experience here. We are at an academic institution at UC, and the Christ Hospital, while it is our community hospital affiliate, is a great way to experience another way of practicing. So all of the docs who we work with over there have their own private practices, and they are really excited to teach us and for us to be involved with their patients. So it's a great opportunity, especially for gyne surgeries, because they have done all of the workup and everything in the office, and then they bring them to the Christ Hospital to operate on them, and are really excited to show us their way of doing things, to get us involved, and to teach us just new ways of operating and working things up and managing patients postoperatively.
There are about 80 full-time volunteer faculty there that we get to spend a lot of time with, especially in the GYN realm. So we do a lot of operating there and end up spending almost a quarter of our time there. I think it's a really unique opportunity to A, do a lot of surgery, and B, to kind of see how different practice patterns run. There's everywhere from solo private practice to large hospital-owned groups, and so if you're interested in any sort of private practice setting, you really get to experience what that's like and kind of talk to people about their experiences and how they work.
So as a first year, you do a rotation called family planning. This is a rotation that includes rotating at Planned Parenthood, but it also includes rotating at some of our outside facilities. So we can rotate at some of the community centers, and one of those is Price Hill, where we work with one of our attendings that primarily sees most of our Hispanic population. You also get to rotate at other facilities within the area as well and really see where your patients are coming from. And it kind of allows you to be able to take care of them best when they come into the hospital because you realize what healthcare disparities they're up against. So it really opens your eyes, especially for someone like myself that's not from Cincinnati, to know where our patients are coming from and not just know what clinic they go to based on their note that you read in the hospital. It really allows you to connect with them and understand what they're up against, not only in their hospitalization, but outside of that with regards to their health.
I think Cincinnati's a really fun place to live. It's a convenient city in that it's not too big, but there's also a lot going on here. There's pretty good access to hiking trails and running trails throughout the city. My wife and I have a dog, so we take him to some of the rivers in the area, as well as some of the restaurants and bars with outside seating and things like that. But it's definitely a place that there's always plenty to do.
My night rotation, our resident cohort would have weekly brunches to celebrate the end of the week, which was very nice to get to know other residents in different classes on a personal level rather than just in the work environment. So that's been really fun to experience.
The residents live everywhere, everywhere from downtown to OTR. If you apply to New York City, people are going to say, well, you can afford to live over here. It's the Midwest, it's Cincinnati. You can afford to live wherever you choose to live. If you want to live in an urban environment, great. Downtown's an excellent part of town. It's where I live. But if you want to buy a house, houses are reasonably priced, and you can definitely buy a house if you want. We have a lot of our residents that have bought houses and have families and are able to do that and kind of everything in between. Like, it's the Midwest, and you're able to afford any living situation and housing option you choose. We have many residents that also live in Kentucky, which is a great place to live as well.
I think one of the unique things about training at UC is you can live in many different ways and still be with very close proximity to the hospital. So if you want to live downtown in a condo or you want to live in more of the suburbs, you have those options, and it's a very affordable city to live in, even on a resident salary. We live in Oakley, which is one of the suburbs a little bit like 3 miles north of the hospital. We actually own our own house. We bought a house when we got here. We love where we live. We have 2 small dogs. We have a backyard. It's a very walkable area. And a lot of our co-residents actually live in that area too. But like I said, in Cincinnati, you can live in any way you want. If you want to live in an apartment, or if you want to have like a house with a backyard, or somewhere that has a good school district, all of that is available in Cincinnati, and it's available at a very affordable price.
I live actually in Kentucky, and I've lived a little bit all over the place as I've gone through my career here in Cincinnati. I initially lived right across the street from the hospital while I was in medical school, and while that was really convenient and easy to walk to and easy to get to downtown, I decided for residency that I wanted to move across the river so that I could just be in a little bit of a quieter community. So we really enjoy living out there. I'm about a 25 to 30 minute drive in, which is very doable in order to get here for work. But it gives me kind of some time and distance from work, and then also is a great living situation for me at this point in my life.
Thank you for watching our video about our residency program here at the University of Cincinnati College of Medicine in the Department of Obstetrics and Gynecology. We'd really like to get some feedback from you, and you can always call me anytime as chair. You can contact me at thomasma@ucmail.uc.edu. We'd like your feedback, and we'd like you to keep in touch with us. If you have any other questions, we're always here for you.